I have to admit, I went into medical school not really knowing what field I would enter. Third year of medical school, you go through different rotations, and I went through 2 weeks of orthopedic surgery. I felt I wanted to be a surgeon. It just seemed to be more gratifying to be a little bit more active than to just sit in an office. So surgery itself appealed to me. During my rotation, they mentioned that one of the professors mentioned that he saw two main driving factors towards orthopedic surgery. One was a love of sports, and secondly, mathematics. And I am a big sports fan, and I happen to be very mathematically competent. So it seemed like a natural fit. Then the rotation itself seemed very much to my liking, so I think it kind of steered me. And then finally, I guess towards sports medicine itself, the whole concept of using a camera and working that way, it kind of reminded me of video games, to be honest with you, and that it just was an area that I thought was a good fit for me. So I would say the vast majority of my patients do not have surgery. The endpoint is really what their goals are. Every doctor has different perspectives on what they think is a success. I tend to think that returning to an active lifestyle is hopefully the goal that we can achieve. Certainly, surgery is not going to be an answer for everyone, and if I don't think that surgery is a good option, I will let them know that. And certainly we use other modalities such as injections, therapy, but ultimately we're trying to achieve the same goal, which is to get back to a functional lifestyle, hopefully active lifestyle. I try to give them options and try the best I can to steer them not in one particular direction, but for them to be their own best advocate for their care, to make what we call an informed decision. So give them options and let them decide for themselves. Try to answer questions where they have some, and make a decision based on that. So I think optimally we go over their condition, explain conservative or operative treatments, and what would be the pluses and minuses of both, and then make a decision based on that. And that would be how I would approach things.